Welcome to Benita's maternity program antenatal class. Today, Sister Talia will be speaking to us about constipation in infants and toddlers. Welcome, Sister Talia.
Hi. Yes, moms. Hi and welcome. So today we'll be speaking about constipation. This is quite a big problem that happens quite often during the baby's first year or 2 years of life. So it's quite a nice thing to get to know and what to do when it happens. Constipation in infants and toddlers. So constipation will be a factor that influences the early development of childhood as well as the bowel. So what happens, it's due to the iron content of the milk, so a lot of the formula milk, and even with breastfed babies, they can become constipated as well. So it's the consistency of the stools, that's how we can identify its constipation. It will be hard clay-like stools that is very difficult to pass, or small pebble-like stools, and that's part of the symptom of constipation. Bowel movements will have a change as solids and other factors are introduced. So how do I know my baby's constipated and what are the signs? The frequency of the stool, so there will be a less frequency of stool. The consistency of the stool, so like I mentioned earlier, the pebble-like, the straining, blood in stool, and refusal to eat. So frequency. Babies that breastfeed do not need to actually pass stool every day. So it normally can go up to a third day, and that is quite normal. However, if a baby is formula fed, we don't want to go more than 2 days without actually passing a poo, because it can disrupt and cause a lot of constipation because of that high iron content in the formula. Straining. For many, straining is usually when it's for a few minutes, it's screaming, baby turns red or purple in the face, and this is according to tablets, and the research was done in 2014. Blood in the stool. So if you notice a streak of blood, it is due to the tearing of the anal cavity, and that is due to the pushing and this hard stool trying to pass through. So if you do see it, Mom, I know it feels very alarming. You can just change the nappy, wipe off, and just put a nice barrier cream by the bum and around the anus, just to comfort baby a bit. Okay. Refusal to eat. There may be a refusal to eat due to feeling full and uncomfortable as a result of the constipation. So the causes of constipation, as mentioned, the infant formula. So formulas are high in iron and also maybe a high in certain fibers and calories diet. They introduce solids, so certain solids like bananas, breads, pastas, high carb content diet does cause constipation as well. How do I relieve my baby's constipation? So the diet is very important. If baby starts on solids, start with prunes, pears, and plums. I say always all the peas. Those are nice and soft and easy to digest, and it helps with constipation and regulating bowel movements. So if you're breastfeeding, continue breastfeeding. If you're formula feeding and your baby is older than 6 months, you can start introducing some boiled cooled water. Why do we use boiled cooled water? Because we want to use sterile water and not just tap water or anything that's not been sterilized. And this will be up until a 50 ml. Don't give too much, because it will just then confuse baby in drinking baby's milk and he will feel too full. And this keeps the stools nice and soft, and it results in less strain. Heat. So a nice warm bath really helps to relax baby, the abdominal muscles as well, and it really prevents that pain and discomfort around the tummy as well. And massage. This I can never emphasize enough, how much massage helps in most things baby related. But with this, it really does have so much efficiency. So you rub baby in a circular motion around the belly button in a clockwise motion. So you will go round, round, just gently. And no, don't push too hard, because remember, if they're already constipated, the tummy is tender. The warmth of your hands helps to soothe and calm your baby. And then my last step is that baby in the picture, that cute baba. So baby's laying down on his back, and you gently move the legs as if they're riding a bicycle. So it's this gentle motion with the little legs. And this really helps the peristaltic movement. So basically the movement of the inside track of the tummy, and it gets everything going. And it also helps with gases. So it gets the gas out, and your baby will feel much more comfortable. So the recommended strategies I offered now in this is what we try and use, and hopefully it works, and we're hoping this is our first line and our last line of defense. However, but doctor can also prescribe some safe medication if it's really severe constipation your baby has, and it's really bleeding every time a poo passes, it's discomfort, and no, none of our strategies work. Doctor can prescribe something that's meant for your babies, and it may be helpful then to take baby if you spot other signs and symptoms, such as a fever. That could be an indication of a larger problem that may require medical treatment. So that's in a nutshell with constipation. And remember, moms, give lots of cuddles and just try and ease baby's discomfort in this time as the stools pass. Change nappies often, and then you put that barrier of protection with the bum cream, especially around the anal area. That just relieves whenever the stools is passing.